Hi there everyone, so this is in case of a seizure. This is my project 1 topic. It includes a starter guide to epilepsy and steps in case a loved one has a seizure. I hope you guys find it informative and maybe one day, hopefully not, you'll know how to use it. So we can start with slide 1, what causes seizures. So seizures can be caused by a variety of factors, epilepsy being one, brain conditions, and more. The initial reaction is that synapses in your brain are firing too often or more than the set amount that your body is used to, which causes a seizure. In simple terms, you can put it as your brain is just working too hard, or it's just doing a little bit too much work than it's usually used to. So what is epilepsy and how does it work? Epilepsy is a chronic neurological disorder that affects the brain and causes people to have recurrent unprovoked seizures. It happens when clusters of nerve cells, such as synapses, in the brain send out abnormal signals, leading to sudden bursts of electrical activity. And depending on the type of epilepsy, as seen in the paragraph, the impact can range from mild to severe, depending on what the person has. So this is very important in detecting what happens with a person when they have a seizure. So some people can stare off, and those are more focal seizures, and sometimes they are present during those and will be able to tell you what is going on just in case something more drastic happens. Usually generalized epilepsy can depend. A lot of those can be tonic-clonic, which will be very severe, and those will be most of the ones that you see like on TV, consciousness, convulsions, and muscle stiffening. But like I said, focal epilepsy can begin in one part of the brain and cause intense or varied symptoms, such as sudden confusion, staring spells, and involuntary movements. So it's a bit different depending on which type you have. The types that most drastically affect people's lives are those with frequent uncontrolled seizures, generally the tonic-clonic seizures, and absence seizures that interrupt awareness, since they lead to injuries, memory problems, and restrictions on independence, such as driving. So, what does knowing what epilepsy is affect your ability to help a person during them having an episode? So, knowing what epilepsy is directly gives you and affects your ability to help a person because it helps you give that understanding that you need to respond calmly, safely, and effectively. If you know that person has epilepsy, you won't panic or assume that person is in immediate danger, or even worse, dying, and you'll know the seizure will likely pass. You'll know how to time it, know what you'll need to do, such as cushion their head, roll them over, and it can just overall save somebody's life. So I believe this is very important. So now for the most important part, what should we do in case somebody has a seizure? First, we need to stay calm. We understand that somebody is having a seizure, an episode, and we know that this might be regular for them, this might not, but you at least know what was going on. Second, you need to keep them safe. Make sure no objects are near their head, just in case it becomes more severe, or if it already is severe, but they don't injure themselves more. Third, position them on their side, and this is to open up the airways and make sure that they don't choke, just in case they throw up or they're just able to breathe a little bit better. And what not to do: do not put objects in their mouth or hold them down. This can cause severe harm for them, and it's just not generally a good idea. If you guys have any questions, I'll be here to help, and I hope this was informative for all of you. This is a very specific topic for me, but I hope you guys all enjoy. Thank you.